Summer fun often means time in the water, splash pads, lakes, the beach, everything in between. But before you jump in, Dr. Brad Thompson with Cone Health LeBauer HealthCare at Grandover Village has some information to help you stay healthy and avoid some common water-related illnesses. So let's first and foremost start off with that one that makes everybody kind of do this all the time, the swimmer's ear. What exactly is it? How does it happen?
Yeah, that's a great question. So imagine your ear canal is like a tiny tunnel. And then after a fun day of playing at the pool, a little bit of water gets back behind there. And when it gets trapped back there, the back of your ear is kind of warm and damp. And that's a great place for harmful bacteria to grow. And as they do that, that's what will cause that itchy, painful infection that we know as swimmer's ear.
All right, let's talk about specifically how we can prevent swimmer's ear in kids, because they're in the water a lot and you tell them to shake their head and that doesn't seem to do anything.
Yeah, absolutely. Great question again. We try to prevent swimmer's ear by keeping that ear dry. Again, remember, it's when the water gets caught back there. So after each time you go swimming, we recommend that you keep your head tilted and let water drain out for somewhere 15 to 30 seconds. Be sure to then dry off the outside of the ear. Don't put anything inside because that can actually cause water to get caught back. And then for kids that are swimming a lot, we usually recommend some type of over-the-counter drying drop just to really make sure you can get all the way down in there and dry it out.
No Q-tip in there trying to dry it out.
None of that, none whatsoever.
Okay, we don't want that. All right, let's talk about, like, if you got a cut, you got a scrape, maybe you just had a new tattoo. When you're talking about going into the pool or oceans or lakes, what should we know about that?
So any type of open sore, even any break of the skin, even with a new tattoo, you can imagine this being like basically a welcome mat to any bacteria. And if you get into that water, this is just a straight way that they can get right into your system and cause you to be very sick. So really, we recommend don't get into any water until it's fully healed. That would be pools, lakes, or even the ocean. And yeah, just to protect yourself the most. At a minimum, please use like a waterproof bandage, but really the safest thing is to wait till it completely heals over.
Okay. All right. When we're talking about the splash pads, which the kids love, the public fountains, which, you know, you see kids running in and out of them all the time. What's the biggest risk and how can we keep our kids safe?
One of the biggest risks when you're using like a splash pad, especially for young children, is coming across a chlorine-resistant parasite called crypto. If this is ingested, this can cause watery diarrhea, abdominal cramping, particularly parents with young children. The big thing is to tell them to keep their mouths closed and to not drink the water. Anyone that ingests it, that's how you can get that infection.
Okay, so that's the biggest thing. Kids, don't drink that water as you're running through the splash pad, okay?
None whatsoever.
All right, now maybe people are at home and they're like, well, we don't go to the splash pad, we got a kiddie pool at home. What should families know about the kiddie pool at home?
So the kiddie pools outside, just like the one I have in my backyard, there's no filter, there's no chlorine, so there's no way to keep that water clean. So as much of a hassle as it is, you really need to change that water out every day. Fresh water means a fresh start, and that's the way to keep it safe. And just kind of getting going back to those principles of you don't want to drink the water, and we just want to stay clean and dry to stay healthy.
If someone, like an adult, accidentally swallows pool or lake water, just how concerning should that be?
Well, a little bit of water that's ingested, it's usually not that much of a problem. But like we were talking a little bit earlier, there are some things you could ingest that can make you sick. Things to watch out for are diarrhea, abdominal cramping, vomiting. If any of these happen, especially in the first day or two, you should definitely call your doctor.
All right, and just let them know, I've been in this kind of body of water and I ingested this water and this is my symptoms. Okay, so instead of just like letting it run its course, you should actually call them.
Yeah, if it's mild and it's been like less than a day, usually most things in the water will get better, whether it be diarrhea or rashes. But again, if these things are persisting or getting worse, please come in. We'd love to see you. Make sure you're just healthy and doing well.
All right, well, with natural water like oceans or lakes, what precautions can help protect against infections or bacteria?
Yeah, that's a great question. The first thing I would say is you need to just use your eyes and just look at the sources of water you might be getting into. Is it murky, stagnant? Is there some thick, scummy stuff on top? Just don't get in it. The second thing I would recommend would be watch your skin. If you're having any open wounds, don't get in the water. And then the third would just be shower off after a day of swimming at the lake or the ocean. Getting a shower to rinse off any type of dirt or grime is going to help you stay healthy.
All right, same thing I'm guessing goes to say if you've got like an itchy rash or something like that after you've been in some kind of water.
Uh, yeah, most rashes will just go away on their own. Maybe some mild irritation or two, maybe a little bit of sunburn from being out in the sun. But yeah, usually you can use something over the counter, such as like hydrocortisone or something, to help keep that soothed. But if it does persist or gets worse, it definitely should be evaluated in the office.
All right, there's always that saying, like your mom used to tell you, you're not allowed to eat lunch and then get in the water and go swimming. So, what's the truth and the myth to that?
But there's a like most things that you hear from your parents, there might be a little bit of truth, but the full context is that if you did eat a very heavy meal and then got in the pool immediately, you might get some abdominal cramping, and that's really the last place you want to be to have that. But unless you are really eating that eighth hot dog and then swimming multiple laps, really most of the time it's pretty safe.
Okay, because we have a little extra time, I wanted to go back to the water in the ear thing because I've had that before and you kind of like, you can almost hear like the sound of the ocean kind of thing. You specifically said don't put anything in your ear like a Q-tip, no towel or anything like that. Why is that such an issue?
Right. So people think with that Q-tip, they're getting all the way back and drying it out, but you can actually flip it on its head, and it's almost more like kind of pushing stuff back in there and kind of can pack it down. So if there's any debris that the water might be clinging to as well, that Q-tip won't pick that up, and that's another great place for that bacteria to grow and cause that infection to get worse.
All right,
So
any
just
final
towel out, just the outside of the ear.
towel out the outside of the ear, that's it. All right, so any final thoughts on staying healthy while enjoying the water-related activities?
Yeah, so the water is a great place for families to make memories over the summer. I just want to kind of reiterate these couple of points. Be sure to just dry off, don't drink the water, and be sure to clean off and make sure you stay safe. And if you do that, that's a great way to have fun this summer in the Triad or at Blues Lake or wherever you're doing your stuff this year.
All right, we appreciate your time and expertise.